closing the door for privacy and washing my hands. Hi, Mr. Rogers. My name's Evelyn. I'm going to be your nurse today, and today I'm going to be conducting a head-to-toe assessment on you, okay? Okay. All right, so can I have your name, last name, and date of birth? Carl Rogers, date of birth 3/15. Okay, any allergies? No. Okay, MR number 7718854, 7718854. Patient doesn't have an allergy band. All right, so I'm going to start off by taking your vitals, okay? Heart rate is 81, blood pressure is 125/77, O2 is 99, temperature is 100.8, respirations are 16, blood sugar is 291. Are you in any pain? Yes. Okay, on a scale from 1 through 10, what would you rate your pain at? A 7. Okay, is it a sharp pain, a dull pain? It's a sharp pain. Does it radiate? No. Okay, what makes it better? Medicine. And what's making it worse? Moving around or when someone messes with it? Okay. All right, so I'm going to go ahead and get started on your head to toe, okay? Okay, so I'm checking the eyes. Okay, and then can you just follow my finger with your eyes? Okay, pupils are equal around reactant to light and accommodation. Mr. Rogers, do you know why you're here today? Yes, my blood sugar was high. Okay, and do you know where you are? Yes, Fortis Hospital. Okay, and do you know what today's date is? Yes, it's 7/16. Okay, perfect. All right, so I'm going to go ahead and also check your mucous membranes, and they are pink, moist, and intact. I'm checking skin turgor, and there is no tinting visible. Okay, so have you had a cough? Yes, I have. Okay, are you coughing anything up? Yes. Okay, what's the color? It's white. Okay, is it thin or thick? It's thin. Okay, and how much would you say you're coughing up? About 5 ml. Okay, perfect. Okay, so now I'm going to go ahead and lift the shirt and assess the patient's chest. So I'm inspecting the chest. It appears to be symmetrical. There is no lesions, no bruising, and no redness or anything. Okay, so now I'm going to go ahead and listen to your lungs, okay? Okay. Okay, lungs are clear bilaterally. I listened to 8 in the front and 10 points in the back. And they are just clear throughout. Okay, and I'm going to assess the arms. There is no redness, no bruising, no lesions that I can see. And I'm assessing the IV site. Okay, is there any pain around the IV site? No, okay. I don't see any redness, any swelling, any signs of infiltration. I will flush it when I give medications. And it's dated for today. So this was put in today. The dressing is clean, dry, and intact. Okay, I'm going to check brachial pulses, and they are 2+ bilaterally, and I'm checking radial pulses, and they are 2+ bilaterally. All right, can you go ahead and grip my fingers? Okay, and can you push up on my hands and push down on my hands? Okay, strength is 5 of 5 bilaterally. I'm going to check capillary refill. Okay, less than 3 seconds, less than 3 seconds, and I don't see any cyanosis in the upper extremities. All right, I'm going back up to the chest. I'm going to listen to your heart sounds, okay? Okay, so aortic valve, second intercostal space on the right. Pulmonic, second intercostal space on the left. Erb's point, third intercostal space on the left. Tricuspid, fourth intercostal space on the left. Mitral, fifth intercostal space on the left. Midclavicular line. I'm going to also listen to your apical pulse for 1 minute. 1 minute is up, and I got 85. And S1, S2 sounds heard throughout. All right, so now I'm going to go ahead and move down to your abdomen. I'm going to inspect the abdomen. I don't see any bruising, any lesions, any abdominal distension or abnormalities. Okay, so now I'm going to auscultate your bowel sounds, okay? Right lower quadrant. Active bowel sounds, right upper quadrant. Active bowel sounds, left upper quadrant. Active bowel sounds, left lower quadrant. Active bowel sounds. So active bowel sounds were heard throughout. Okay, Mr. Rogers, I'm going to palpate your abdomen in the same order, and you let me know if you feel any pain or any tenderness, okay? So right lower quadrant, any pain or tenderness? No. Okay, right upper quadrant, any pain or tenderness? No. Left upper quadrant, any pain or tenderness? No. And left lower quadrant, any pain or tenderness? No. Okay, so palpated all 4 quadrants, and patient reports no pain or tenderness on any of them. When was your last bowel movement? It was today. Okay, and what was the color? It was brown. Okay, unusual odor? No. Okay, the consistency, it was formed. Okay, and then the amount, it was a small amount. Okay, perfect. So now I'm going to go ahead and assess your genitalia. So I'm looking at the genitalia. I don't see any edema. I don't see any redness, any drainage, any abnormalities, no bruising around the area. When was the last time you voided? Today. Okay, and how much would you say you voided? It was about 175 mLs. Okay. What was the color? Yellow. Okay, was it clear or cloudy? It was clear. Okay. All right, so I'm going to move down to the legs, and the skin appears to be warm and dry. I don't see any lesions, any bruising. Do your legs hurt anywhere when I'm touching? No. Okay. I don't see any signs of cyanosis on the upper legs either. Okay, so I'm just going to go ahead and check your tibial pulses and then your dorsalis pedis, okay? Okay, so I'm checking tibial pulses, 2+, and then dorsalis pedis, 2+. I'm checking for cyanosis of the toes. Capillary refill. Okay, less than 3 seconds. I don't see any cyanosis on the feet. Okay, and I'm not going to mess with your right heel just yet, okay? Because I know that was making you uncomfortable, so I'm probably going to give you the pain medication before we do anything with the feet, okay? Can you go ahead and push on my hands with your feet and then push my hands up? Okay, so bilateral lower extremities, 5 out of 5 on strength. And all right, Mr. Rogers, is there anything else I can do for you? No, that was it. Okay, so my bed rails are up, my bed is in the lowest position, the call light is in place, the needs have been met. I'm washing my hands and closing the door for privacy.